Good afternoon, everybody. I'm delighted that so many people have been able to join us this afternoon for the launch of our thematic inspection on safeguarding adults at risk of harm, supervised by the Probation Service. The report was published on the 13th of November. We try to hold these launch events a little bit afterwards so people have a chance to sort of read some of the content of that report. This event should be an opportunity to hear about the findings from that thematic inspection. And hopefully then to provoke some discussion. So if I introduce the team that are here, Louise is our head of comms, and Holly has been doing all of the sort of arrangements and ensuring that it's properly shepherded. As Louise has already said, the session will be recorded and available on YouTube for those that want to view the session afterwards. We'll kick off with David Miners, who was our lead HMI on this report, that will talk through the report, how the inspection worked, some of the key findings. And then we'll pass over to Samira and Paul from User Voice, who spoke to those with lived experience about their experience of the system. And then we'll conclude with Helena Moore, who will talk about some of the effective practice that we found during this inspection. And then hopefully we will leave plenty of time for Q&A at the beginning. And I should have started off by introducing myself. I'm Martin Jones. I'm the Chief Inspector of Probation. I've been Chief Inspector of Probation since the spring of 2024. Could I have the next slide, please? So just to say a few words about what the Inspectorate does. Our vision is to drive high quality probation and youth justice services that change people's lives for the better. And as the independent inspectorate, we set the standards that shine a light on the quality and impact of those services. And our inspections, reviews, research and effective practice products should provide authoritative and evidence-based judgments and guidance. And evidence-based for me is a vital component of this. What we try to look at is the quality of the work actually being delivered at the front line, whether that's in probation or youth justice services. And quite often there's a clear line between what the aspiration is of what a service might want to deliver and the actual reality of what it is. And I think that's particularly one of the themes that's going to run through this thematic inspection today. And we seek to use our voice to drive system change with a focus on inclusion and diversity. And our aim is that our scrutiny leads to improved outcomes for both individuals and communities. Just in terms of this report, David will talk you through some of the key findings. I've got to say, I think this is one of the most important thematic inspections that the Inspectorate has done in recent years. It's an area that perhaps hasn't received the attention it deserves. Now, the Probation Service is currently supervising somewhere in the region of 168,000 people in the community. That's a complex caseload, and quite often those individuals have deep underpinning needs. And the numbers which David will talk to you are quite sort of indicative of the challenges that those individuals face, both in relation to the number of people that die each year under the supervision of the Probation Service, the number of suicides, the number of drug-related deaths. My very strong view as Chief Inspector is the system should do all it can to ensure that we safeguard vulnerable individuals, but also that if we do that better, actually, then we improve the chances of better outcomes both for those individuals and also communities. But without further ado, I will pass over to the expert, David Miners, to talk you through the findings of our report. Thank you.
Expert sounds a little bit of a challenging title, but certainly I've spent the last 12 months looking at this area and how probation practice applies to it. But good afternoon to everyone. I'll go through the key findings and then we'll hear from User Voice, Paul and Samira, and also then from Helena Moore, who will talk about the effective practice side. So first of all, it is a thematic on safeguarding the impact of safeguarding policies in relation to people on probation. So we often hear about safeguarding in terms of victims and potential victims. This report wasn't about that. It was about the role of the probation service in safeguarding the actual people we supervise. And the context to it and why we undertook that in this inspection is because of the increased level of risk to people on probation in lots of areas, and in terms of often the abuse and neglect they've experienced in their development. Know about adverse child experiences. research undertaken, one of the key research papers by Bellis in 2015, looked at this in terms of the effect of the criminal justice system. And what he found in terms of people who had experienced 4 ACEs, and in terms of ACEs, we're talking about abuse, neglect, and trauma. What they found was that people who had 4 ACEs were 15 times more likely to have committed violence against another person in the previous 12 months, 16 times more likely to have used crack cocaine or heroin, 14 times more likely to have been a victim of violence over the last 12 months, and 20 more times likely to have been incarcerated at any point of their lifetime. So everyone will know we manage people who present difficult, violent behaviour, and the pressure is around public protection. But I think it's important we remember that a lot of their story is that they've been victims themselves at some point. The context is also the Care Act of 2014, which puts some responsibilities on the Probation Service. So that came in. At the time, there was a particular focus on approved premises and safeguarding practice in prisons, but it does put a statutory responsibility on the service to ensure the people who are supervised get the correct interventions. Obviously, there's a range of probation policy in these areas, and the inspection had the opportunity to review those. And of course, underpinning the work of probation is the effectiveness of multi-agency arrangements in this area. So that was something we also looked at. If we move on to the next slide, Holly. Okay, in terms of a methodology, just we undertook, we asked for evidence in advance. We identified 6 probation delivery units across 6 regions, which we inspected during May and July last year. During those part of those inspections was a consideration of 99 cases in total, and for those cases we developed a bespoke methodology which looked specifically at practice within that area, so looking at how risks to individuals were managed in terms of drug abuse, or in terms of suicide, or in terms of other risks such as organised crime, in terms of what risks they faced. We also use a voice, as with all our thematics, were a key part of our methodology. They'll be speaking later, but they undertook a survey of 200. They undertook a survey in the regions where we inspected, then 242 responses, and they also undertook 26 interviews. And like I said, we had some key evidence in advance as well. We also, as per usual, actually undertook a national week at the end of having been out to the 6 PDUs, and during that we spoke to the key national policy leads in relation to areas such as death under supervision, drugs policy, safeguarding health, that sort of area. Okay, if we move on, Holly. Martin said at the beginning about contextual facts. I gave you some in terms of the impact of ACEs, but these are some key facts in terms of the risks which the caseload faces. Over 1,404 people was the number of people on probation who experienced death between 23 and 24. 392 was the number of those deaths which were recorded as self-inflicted. 306 was the number of deaths which are drug-related. And there also is 1,267 is the number of people who were identified as committing suicide during a 10-year period. I think a key figure which came out of work done actually as part of the National Health and Social Care initiatives was they undertook a review of one particular PDU and found that in a 12-month period, 69% of people who were being managed by PDU had at least one emergency attendance, and for 34% they attended 5 or more times, which I think highlights the ongoing risks and I don't want to use the word vulnerability, but the risks and challenges which the probation caseload faces. Okay, we move on. Okay, in terms of national leadership then, what we found was attendance and safeguarding adults boards is a key direction for senior leaders within the regions. And earlier this year, a national partnership framework updating the safeguarding adults at risk in the community policy was published. What we found about that was that there was evidence of it being of PDUs being aware. We found in most of the PDUs that the directions of the national policy are being put into place, but in terms of the impact in terms of practice for people on probation, we found that to be minimal. Health and social care is a growing priority for the Probation Service, and is underpinned by a clear national partnership agreement. And we saw some evidence of some positive initiatives in relation to that. We saw initiatives such as there's going to be a pilot for GPs in regions and for GP registration via the probation PDUs. And we also saw some shared access in terms of health tests, that sort of thing. I mean, generally, I think we welcomed the shift towards a more holistic approach in relation to probation in that area. There was a recognition that as part of engagement strategies, addressing people's health and well-being was relevant, and it wasn't just about focusing on what might be perceived as offending behaviour or previous offending. Engagement, obviously, and the forming of relationships we talk about a lot as undercore in probation practice. Relevant health initiatives which are meaningful to people's individual lives are of the potentially a key strategy. National suicide prevention plan, that's been put into place, and we certainly saw evidence in the regions of suicide forums being set up. I think that the impact of those is still in its early days, and I wouldn't say it was fully integrated either strategically or operationally. In terms of the death under supervision policy, you'll be aware that this was introduced in 2022, so that when someone dies during whilst they're under supervision, there is now a formal review which has taken place, and a team's been set up nationally and within the regions as people with clear responsibilities to undertake and implement the policy. We think it's a really important framework because we think there is learning to be done. But our concern around it was that it could become focused on individual practice rather than rather than precipitating systemic learning. And in terms of what we heard and when we spoke to practitioners, there was some concern that the focus on individual practice was the key driver. I think you know, in terms of what we're saying, this is what I've just outlined in terms of the vulnerability of the caseload, the risks to the caseload. It's important that that's about systemic learning and not just another device to look at individual practice or errors. Obviously, there might be some room for that, but I think, you know, I've highlighted and drawn out how vulnerable or that the risk this caseload faces, and it's important that practice and delivery recognises that and is meaningful to that, and isn't you know, it isn't idealistic. It needs to meet the needs of the caseload, and those are some of the needs. If we move on. Holly, thanks a lot. Okay, in terms of local practice, probation, part of the framework I've just talked about was that senior managers should attend the safeguarding adult boards, which are held in local area councils. We found that attendance was regular, but again, the impact on service delivery for people on probation was limited. There's a lack of consistent data in terms of adult social care referrals, and there wasn't any evidence of escalation pathways, or certainly there were some cases which were taken on, but this wasn't done consistently. I mean, it was indicative that in terms of adult social care, yes, probation's attending the meetings, but it's not fully embedded operationally at operational level. And what we found amongst practitioners, and I'll talk about this a little bit when I get onto delivery, is that they didn't have confidence that probation referrals would be either prioritised or accepted because of the threshold. In terms of mental health services, again, we found some PDUs had developed escalation pathways or direct referral routes into mental health, but we also found limitations in terms of probation being, mental health services being made available to probation practitioners, and in many respects, this wasn't because referrals were made. It was because thresholds weren't met, or services decided they didn't want to, or mental health services decided they didn't want to offer services. And I think, you know, it highlights the limitations on the probation service's ability to ensure appropriate support for people on probation. In some respects, where probation's involved, other services are sometimes less likely to get involved. There's still a perception that probation's a welfare service and can provide support for issues such as mental health. And I think that's important to recognise that. I mean, in terms of multi-agency risk management meetings are held under adult social care, that's the acronym there, MARMS. They're held under the auspices of Safeguarding Adults boards, and they're an initiative that's being pushed, and they do have potential for ensuring for probation engaging other services to look at specific cases, but again, their utilisation and their use is still in its early days. What we found in the gap was that MAPA was frequently used, regardless of the level of imminent risk, to engage services to manage people, obviously where cases were either MAPA identified or Category 3 was used. There were some good initiatives in terms of the engaging people on probation teams, where these were integrated with PDU teams. We saw some good work in those areas, and that seems another avenue which can be developed in terms of understanding the needs of the people probation supervising. If we go over, please. Holly, thanks a lot. Okay, so what did we find in terms of actual delivery? In terms of registrations, and by registrations I mean particularly the balls on NDELIS, we found these to be used inconsistently. People found them inaccessible and often contradictory. So for instance, vulnerability, the assessment of vulnerability on OASIS should lead to and the vulnerability being identified as a risk on NDELIS. This was done in most of the cases, but we did find cases where, for instance, someone might be identified as at risk of suicide or suicide ideation, but then not being assessed as vulnerable. So that's the sort of contradiction I'm talking about. Overall, there's a lot of risk registration. Someone said to me there were 78. I didn't see 78 in the form which I downloaded from NDELIS, but it does seem that they're used differently in different regions and indeed within PDUs as well. We also found in terms of assessment in silo, and there's been a lot of emphasis, not least driven by the inspectorate. So let's be absolutely upfront about this, about the assessment for public protection. And safeguarding the person on probation hasn't necessarily been a focus of that, even though the issues involved are often very, very linked. If someone's got mental health problems, there's also often a risk to them, but it's also often leads to their increasing their risk to other people. Similarly, drug abuse, similarly, for instance, involvement in organised crime. I think what we've said is that the OASIS, when we spoke to the people who are developing ARNS, in a sense embeds that sort of assessment in a silo, and we think that probation assessment should take a far more holistic approach. And I understand that's what ARNS will be developing. In terms of adult social care referrals, I talked about agencies not being or adult social care practitioners not having confidence in adult social care referrals. And in some areas there are minimal. Adult safeguarding boards, apart from in one region, was not monitoring them, although in that particular region they were having the drive to increase them. But what we identified was a concern that basically probation referrals weren't accepted. And that, in a sense, was in line with the research done on safeguarding serious case reviews under adult safeguarding board. There was a lot of research done by Michael Preston Shute, who looked at the reviews both recently and up to 2020. And what he found was within adult social care, a deserving and undeserving thresholding decisions. This sense that some people deserve services, some people didn't. We weren't able to absolutely link that to probation, but we do think that culture might well be operating, and we think that's something which senior managers at safeguarding adult boards, but also nationally, is something that should be taken up, because, like I said, people on probation are some of the most vulnerable people in our society. I've talked about escalation policy, so I won't go on that. But in terms of service delivery and engagement strategies, it was very interesting in terms of trauma-informed practice, which has been a real big focus for the Probation Service over the last 10 years. We heard very little of it, how it applied to men. We heard a lot of practice and focus on the undoubted traumas which women on the caseload and the risks which women on the caseload face. But I think in terms of how that is applied for men, or how that's assessed in men, or how it's made relevant to men, there was we found limited evidence of that. I mean, I did speak to Paul Galdus, who's a professor in men's health at York University. Very interesting, because he's done quite a lot of research in terms of engagement strategies for men, because in the health service, engaging men, particularly around their vulnerabilities, has been problematic, is seen as problematic. Men are less likely to go to GPs, etc. And he's done some work on that. And I think there are some lessons across the board for the Probation Service in that respect. Okay, Holly, I'm hoping that banging isn't going on, but I apologise to anyone if it is. Okay, just continuing with what we found. I've talked about assessment, you know, in terms of what we found almost like a false distinction between focusing on public protection and safeguarding adults in most cases. I think in terms of part of that, like I said, is driven by OASIS, but I think it's also, and this is because of the focus and understandable focus and expectation which practitioners and probation services have been under to particularly focus on that area. But like I said, I think it's a false distinction. I think, you know, it should be a more holistic approach. If someone's involved in drug dealing, for instance, in working under organised crime or under a county lines gang, it's very, very likely that they're going to be experiencing violence, almost violence and intimidation on a weekly basis. But we didn't see evidence of those sort of issues routinely being incorporated into the planning for the case. At the same time, in terms of planning, again, we didn't see the safeguarding adults or specific risks to adults being incorporated into planning. They weren't in risk management plans, they weren't in the sentence plans. But, and I think this is really key, and I found this reassuring because I haven't been in practice for well, as a main grade probation officer, the last time I was main grade probation was 15 years ago. But my memory was dealing with people in crisis almost on a consistent basis. And that's what we found with this. So although the planning wasn't relevant, what we did find was some really effective work being done by probation practitioners in managing crisis. People presenting with issues which put them at risk, and then forming good relationships and trying to get them into the right services. Like I said, those services weren't always responsive. They weren't always responsive. They weren't. The thresholds were often too high, or they were told they weren't applied. But I think, you know, in terms of that management of the cases, probation there was some good work. And again, in terms of delivery, you know, it was often in isolation, and I've got to say, in terms of mental health engagement, that was inconsistent, and that wasn't about practitioners not making referrals. It was about mental health services wanting to engage even with their previous histories. In terms of delivery, in terms of the services, we did find that services for women and delivery was better. I think it's 75% complied with 56% in terms of men, but we found that the developing approach for 18 to 25-year-old cohort, that services, and particularly in this area, were working well. I talked about some of the strategic health and justice initiatives, and I talked about the GP registration plot. In regions, health and justice coordinators have been implemented as a part of that, and we did find in some areas that they were making a positive impact, and particularly in relation to pre-release planning. But there were examples of hepatitis C and health testing on site as well. In terms of reset, I've got to say, we saw the cases we saw were very early in reset, so we didn't make too much conclusions from that. We didn't want to make too many assumptions, but we did find in those cases, and like I say, it was early on after reset came on, and let's be frank, the probation service was under a lot of pressure as a result of reset, with SDS 40, etc. That we did find limited evidence in terms of when the services were being drawn of planning in relation to the risks that people on probation planned. And like I said earlier on, engaging people on probation, there were some positive initiatives. Okay, if we just move on. Okay, in terms of recommendations, we made 7 recommendations. I think I've explained why we've supported the death under supervision process, but we said it should be focused on systemic learning. We talked about adult social care. We think that referrals to those should be monitored. An escalation process is put in place. Like I said, at the moment they're minimal and inconsistent, and the services aren't necessarily available for people on probation. That's something to be taken, I think, both nationally and at the Safeguarding Adults boards. We've talked about trauma-informed practice. 90% of the caseload is men, and a lot of those men have experienced abuse, neglect and trauma. Obviously, they also present as very, very difficult, very challenging, and have often committed some horrendous crimes. But at the same time, as part of their management and their safe management for the community, the risks which they've experienced and the traumas they've experienced needs to be taken into their assessment and in terms of their supervision. In terms of, I've talked about assessment. We think that the risk to people should be an integrated, more holistic approach to assessment. That's not because the problem is you end up probation wants to appear tough and not taking on not in that whole thing of feeling sorry for people who've committed horrendous offences. But the truth of the matter is, public protection's got to be a holistic approach rather than just looking at their offences, because often their experiences are directly related to their behaviour. And then finally, the last three. We have said the use of the word vulnerability, and I've tried to avoid it in this presentation, even though I've fallen into it a couple of times. We think it should be assessed. We're not making a recommendation it be taken out, but we did find that it was used, the assessment of it was very, very inconsistent. Interestingly enough, in that Care Act I talked about at the beginning, they've removed the word vulnerability and they talk about risks to the individual. And in terms of when we spoke to practitioners, there was a lack of certainty about what vulnerability was. You know, it might be a specific vulnerability which someone faced, or it might be the situations they're in terms of vulnerability. Such a generic term, I think, personally, I think it is much easier to talk about the risks and specific issues rather than that generic term. And in terms of that vulnerability, what we did find that for men, it was something like 5% of the caseload were assessed as vulnerable. We thought that was pretty low, to be absolutely frank, given what we know about ACEs and the risks we talked about, the level of deaths and drug use and dangers from that. So we think in terms of assessment, there should be a review of that in terms of make sure it isn't being influenced around assumptions around gender. Talked about risk registrations. We think they should be reviewed. There's too many and it's too complicated. And then finally, it is a developing area of work, but we think the suicide prevention work needs to be central probation delivery, and the training, which has been produced in the last couple of years, that it should be made mandatory. Okay, at this stage, I am going to hand over to my colleagues Samira and Paul from User Voice, whose work was really, really helpful in terms of both when we went out on field work and in terms of producing the report. So good to have you here, Samira and Paul. Thanks very much.
No worries, thank you. So I'm going to start off today. So hi, my name's Samira. I work at User Voice and I've been here for about 3 years now. So I'm here today with my colleague Paul, and we're going to be talking about the work we did with probation to support probation on the voice of adults at risk of harm on probation. So I'm going to hand over to my colleague Paul now.
Thanks, Samira. Could you just change the slide, please? Thank you. Yeah, my name is Paul. I'll just explain about User Voice. We're an organisation at User Voice. Our purpose is to change minds and transform lives by bringing together people impacted by the justice system with those who deliver its services to create much needed transformative change. As it says, we believe justice should heal as much as it punishes, creating safer communities for all. And 80% of our staff have convictions, meaning that we've been there in court, in prison, or on probation. We own our own pasts, so we understand the challenges firsthand and use our own lived expertise to inform everything we do. On that note, I'm willing to share basically that I've been in prison, I've been on probation. It's interesting that you mentioned about ACEs, because I lost both my grandparents at 5, lost my mum at 8, so they're obviously trauma situations. Funnily enough, though, it didn't end there. I grew up in the 90s, so a lot of drugs were about. There wasn't services there to help me. I probably wouldn't have gone to the services due to the stigma at that time. It's a lot different than what it is now, thankfully. There is a lot more support, I think, out there, and a lot more understanding of mental health. Growing up, I used drugs, cannabis, moved on to ecstasy, going to raves, etc. Until 1999, I ended up in an adult psychiatric unit at 17. I was diagnosed then with schizophrenia. I don't have schizophrenia. It was drug-induced psychosis due to the bad LSD and probably the trauma of growing up and the death, etc. I also looked after my disabled dad. I had no siblings, no other family really. Apart when my granddad passed away, it was just us two. Anyway, my dad passed away in 2018. Before that, actually, I actually worked for community mental health team in Manchester, probably quite near to where Holly is now. The Central Manchester Community Mental Health Team as an assistant practitioner. So I've obviously got both sides of mental health experience, and I'm working in mental health. Unfortunately, I lost that job. It was my own fault. And then I started using harder drugs, crack cocaine, and then when I found heroin, I didn't even know that you could smoke heroin. I was 29-year-old. I was very naive in that respect because I don't like needles. It's quite ironic, really, that I'm a heroin addict who doesn't like needles. But I used heroin for about 7 years, and I tried to get off it, and my dad passed away and he had some money. And I remember being with individuals that were using. Then someone mentioned the word vulnerable, and I was like, no chance. You know what I mean? As a man, I didn't want to be seen as vulnerable. I saw it then as weak. Obviously, I understand now in criminal justice that vulnerable does have a lot of other what's the word, usage kind of. I spoke to David about the word vulnerable as well before. Obviously in prison, a vulnerable a vulnerable prisoner is quite often a sex offender or someone who's on protection. So again, that's people in the community who are aware of that and say are on the mains. Nothing against anyone's crime, obviously, but that's a big thing in itself. I think changing that word is definitely is a big thing. So basically, I was using with people. I wanted to get away. I'd never been to the northeast before. I went on Rightmove and saw somewhere near the sea. I thought I'll get into fishing again. I'll move up there and get away from drugs. I think I've been up here 2 days. I took 20 bits, as you know, so I took say 16 rocks of crack cocaine and then 4 grams to try and level me out. It's quite strange, really, how you'd have something that sends you up to bring you down to level you out. So really, I was self-harming through drugs. I'd say I didn't actually self-harm, cutting myself or anything like that. But my self-harm was drugs. I ended up getting caught actually on the motorway, trying to drive back to Manchester to score more drugs, and then I was 8 times over the limit on cocaine. So to like quote quite a famous song, a famous lyric, I rocked it until the wheels fell off, really, because the car that was driving, it was not funny. Obviously, nothing's glorified about being a heroin addict. You know what I mean? It's I share my story to try and help others, basically. But now I went to prison, Forest Bank, and then Risley in 2020, just 3 days before lockdown. So obviously there wasn't a lot going on then, jobs-wise. I was put in a cell, which was the best thing for me in hindsight. I had a really good worker at Forest Bank who helped me, like a drug and alcohol worker. She was brilliant. And then I moved up to the northeast properly, and I had a brilliant probation worker. Her name's Leslie MacArthur Smith. She's retired now, but she was based in the Annick office, and she mentioned about Use of Ice because I knew that prisons weren't working in a lot of areas, so I wanted to try and change it as best I could. I ended up not getting the job then because I was on 50 ml of methadone, which in the summer of 2022, I just stopped taking. I thought, I'm not in recovery, I'm recovered. I'm never going to be using heroin, crack again. Sorry, I'm just getting told to speed up. I will in a minute. But obviously, yeah, so I ended up coming off methadone, worked for another organisation that gives people second chances. And then I worked at Northumberland at a farm shop. And then obviously I got used to the staff and I thought I'd apply for the job again with Use Your Voice. So now I facilitate the HMP Northumberland Prison Council, and I was doing the HMP Loudon Grange Council as well. It's interesting that you mentioned about self-harm and suicide prevention, because along with an IPP who approached me knowing that I had lived experience, I helped to set up a self-harm and suicide peer prevention group in Northumberland based on a 6-session model that myself, the gentleman who's now been released, which is fantastic, and a couple of other reps set up. So I do know obviously about the self-harm suicide prevention, and it's good that you're obviously looking at that and recognising that it does need some work doing. So yeah, next slide please. I'll move on to the findings that we did along with Samira. Sorry, Samira.
No worries, thanks Paul. So let's go on to a bit about our methodology and what we did. So Use Your Voice conducted surveys and interviews with individuals that were marked of risk of harm. So as I think a gentleman said before, 268 people were spoken to, and we did 26 interviews, and we also did 242 surveys. So lots of really good data there. So the overall objective of the consultation was really to understand the experience of these adults at risk of harm. So what happens to them when they go on probation? Are their needs met, and are they not? So specifically, we were thinking about in relation to safeguarding. So our main objectives, as I just said, were to understand what support adults at risk need, what they have had, what they haven't had, and then really to sort of better gauge their understanding of their time on probation, just to understand their whole experience. Another area that we looked at was the quality of the relationship with their probation practitioner, which was a really positive actually, but I'll go on to talk about that a bit later. And then to understand any specifics really. So what was it that was positive and what was it that was challenging to do with their probation experience? And I'll hand back over to Paul for the next slide. Thank you.
Thank you. So offence and vulnerability, pleasingly, over 65% of participants told us that they were happy with the support that they received from probation. Although all participants were classed as vulnerable, adults at risk of harm by probation, only 77% saw themselves as vulnerable, often because they viewed this as a past issue. Alarmingly, 90% of participants reported being neurodivergent. We have done research on that before. If you want to look on our website for this report more in depth and the work that we've done with neurodiversity, especially in prisons. Going back to this study, 65% of participants reported that the vulnerability was connected to their offence, citing factors such as domestic abuse, substance misuse, mental health challenges, exploitation, and PTSD-related reactions, e.g. when unexpectedly being grabbed from behind, which is what one gentleman told me set off his PTSD, and that's obviously he lashed out. He got prosecuted for violence. Some people said that prison and probation experience itself had made them feel vulnerable. And at User Voice, what we do, I know that you mentioned recommendations, it's very similar, peer-led solutions, we're solution focused, so we find out the issue and then we try and find solutions. So our solution is practitioners should ensure communication is clear and consistent, particularly for those with neurodiverse conditions, to reduce anxiety. For example, provide appointment reminders, which is a big thing when requested, and avoid cancelling or rescheduling appointments. And below there is a quote mentioning about the reminders of appointments. I'd just like to mention, obviously, these were very complex individuals. It wasn't just like said that have mental health issues, but that have a range of mental health, physical. They had a lot of things going on, so obviously it was very complex. So I think even reminders, as simple as it might sound, will help a lot of people, especially like memory issues mentioned there. Thank you, Alejandro. Next slide, please.
Thanks, Paul. So I'm going to talk a little bit now about release from prison and then the probation induction experience. So this was quite a mixed response. So we had about half of the people interviewed said that they had like a release plan, they had a probation practitioner, met them before their release and really considered their vulnerabilities. This was really great to hear. And then equally, another half sort of reported no, they were released without any plan or knowing where to go. So 50% of people said probation took time to understand their vulnerabilities in induction. So that's really positive. And what they said about these good inductions was that it wasn't just a one size fits all. These practitioners really took time to understand people's vulnerabilities. And as Paul just said, it's not always just one thing. Often people have complex needs and overlapping dual diagnoses, things like that. Also neurodivergent needs. So those who said they weren't happy with their induction, they used the word tick boxy, and they just felt that those practitioners were focusing on the offence rather than moving towards desistance. And then we've got a peer-led solution. So we think that no person on probation who is classed as a vulnerable adult at risk of harm should end up homeless after coming out of prison. And this one is really close to my heart. Just from my own personal experience, I actually walked away from court after being in prison with no release plan at all, homeless in London, so I can really relate to that. And also also just from my own experience in a previous role as a caseworker, I had a caseload of people actually who were, lots of them were homeless, so I had to meet them in cafes, I had to meet them in McDonald's or even on the street, and it was just impossible. And then it leads to that revolving door of people going back into prison. So I don't know, there's no easy solution to this, is there? Because obviously it's to do with money and the government often, but yeah, it's a really big one, as I'm sure you'll all know, these people. And then underneath we've got another quote. So as Paul said, you can go to our website and have a read of the full report, which has got a lot more quotes on there. So I'll hand back over to Paul. Next slide, please.
Thanks, Samira. Appointments and services. When asked what is the biggest issue that people have faced whilst on probation, difficulty to travel to appointments due to mental health, physical challenges or financial reasons, or a mixture of all three, were the most common responses. Also, 19% of the participants said that they do not feel safe when going to probation officers. Sharing my lived experience again, obviously I went from, as I term it, crack man to Batman. A crack crime now and help to rehabilitate the streets. But when I was on probation, for example, and using or not wanting to use a certain day, if I or other people that have discussed it as well, go into a probation office where there's other users, you know, it's hard to say no if you're not strong enough. Then at that time, you're going to. I know it's up to yourself, but it is very difficult. So I think that's just one example. I know that other people that we work with in prison, for example, they're scared due to the offence of going to the probation office, and sometimes they'll miss and then get recalled. 59% agreed that probation have helped them to access all the services that they need, and half had received additional support for their vulnerabilities. People said that mental health and housing services were the hardest to access, and our peer-led solution, when possible, offer more remote appointments and check-ins, say even Teams, messaging, phone calls, you know, support people who are struggling financially with the travel costs. I know that you do that, but it's having the money up front to get to, some people were saying that we're traveling a long way, which would take 3-4 hours to get there, and with physical health difficulties and mental health, anxiety, for example, it's very difficult for people. So like I said, if you read the report on our website, it does go into case studies more in depth. There is a quote there that understanding people's health has an impact. If you can get out and about when it's bad, when it's bad, you can't always get to an office and face seeing someone. This needs to be considered. Next slide, please.
Thanks, Paul. Okay, so we're coming to our last our last area here, and this is about the relationship with the practitioner. And I think this is a really important one, and this is really, really encouraging to hear what we heard. So when asked what has been the most positive aspect of their probation experience, most people talked about the actual relationship with that person, who they can rely on for understanding and support. And a really high percentage, 75%, that said they had a really good relationship with their practitioner. And I think this is a really key strength to build on. And, you know, I had a good experience with a probation officer when I was on probation. So, yeah, that's really, really encouraging. It seems that a lot of the challenges are practical things that are outside that are, you know, difficult to control. But obviously, we've talked about some build on. So 50% of the surveyed individuals and 65% of those interviewed reporting having multiple probation practitioners. Now, this is a bit of a problem, and it's something that comes up often. But again, you know, we understand it's a lot to do with pressures and low staff numbers. So sometimes it's unavoidable. But I think this definitely, when I think back to the interviews, to the people that I talk to, this really has a detrimental effect for this group. As we know, a lot of change for anybody can be difficult to manage. We're all creatures of habit, but I think people who suffer with these vulnerabilities really find that even more difficult. What I was hearing was that they built trust with people and then suddenly had to change to a different person, and that you know, that trust was just gone and they couldn't connect in the same way to the person they'd built the trust with. So yeah, changing of practitioners was mentioned as really challenging by this group of people. And then to a peer-led solution. So how vulnerabilities impact people on probation really need to be considered when organising appointments and deciding on the conditions of their sentence. So again, it's just that not having a one-size-fits-all, and trying to tailor things to individuals, which again can be challenging, but that's what we need to aim for, I think. And then we've got a quote underneath that supports that. Again, more on the website. Next slide, please. And back over to Paul.
Thanks, Samira. So yeah, that's the findings that we've got. Like I said, and Samira's mentioned. If you look on our website, the full report is there. I'd like to. We work with Dr. Jenny Berlin, who's obviously in the audience. She's really good lead researcher who's put a lot of time and effort in going off what the information that we've managed to get off the people that we interviewed. So user voice, amplifying the voices of people with lived experience is key to transformation in the system, because we, or they, or all of us, deeply understand both the problems and the symptoms. I will mention that I have seen that you are hiring a lot more people with experience. As soon as we go into a prison, I get I've got keys, but I don't have a baton. I don't need one or handcuffs or anything like that. Just sharing, just speaking to people on a level, and sharing that you've got lived experience is a very powerful thing. People will open up to us and trust us as well. And we do get things done. We have got a pay rise, for example, for the lowest paid prisoner in HMP Northumberland. We're trying to make the prisons better. We've set people up for release, and then obviously they come to you. But if you would like to get in touch with User Voice, please or know more about our work, and how we can ensure lived experience insights essential to systemic change. My colleague Samira's email address is there, and our website address is www.uservoice.org. And thank you very much for listening to us, and I'll hand over to Helen. Thank you.
Thanks, Samira and Paul, and thanks for both sharing your personal experiences and insights. That was really, really insightful. Okay, so in terms of effective practice, so we have published an effective practice guide alongside our report. And what these guides aim to do is really highlight and draw attention to the practice that we've saw on inspection where we feel they demonstrated where we see our standards delivered well. So to help you navigate all the guides, what you'll see is a contents page, and there's hyperlinks within the contents pages, so you can go straight to any areas of interest, or if you feel like reading the document from cover to cover, that is also perfectly fine. But the guide is there really and intended to be kind of like a toolkit, so you can dip in and out of it depending on what the topic or the theme is that you're focusing on. So hopefully that's useful when you're accessing the products. So you can see from this slide that within the Safeguarding Adults Effective Practice Guide, we have covered areas such as organisational delivery, leadership, engagement strategies, and there's some really good examples of case supervision in the guide also. Next slide, please, Holly. Also, in terms of finding your way around the guide, you will see kind of little pictures there, those little vectors. So they kind of represent where there's additional links, there's external things you can read or review, just to provide the evidence base for the examples, but also that wider reading if you have that particular interest. So you'll see, like I've said, useful links, but also sometimes there's external videos that might be interesting, or maybe some interviews that we've conducted, just depending on which guide you're looking at. And we also have reflection questions sprinkled throughout as well. So often these are at the end of a particular section. They are aimed at all levels of the organisation, and we've just kind of prompted some reflective questions within the guides to kind of allow that stop and think, to maybe consider the examples that you've just had a look at. Are they practicable for your regions or your services? Is there any gaps? You know, all of those type of things. So you'll see them sprinkled throughout the guide. Next slide, please. So as always, there's lots of examples within the guides, and I can't talk about them all here today, so I have picked a handful out to share with you. And the first example is around health-informed safeguarding, which was a national example we saw on inspection. So an emerging model of effective safeguarding practice recognises that critical link between health inequalities and vulnerability among adults on probation. So using the evidence and insights from the core 20+5 probation survey, and the Chief Medical Officer has just published a review on health in justice settings that was published on the 6th of November. What we saw was that probation services have started to embed evidence-based health-informed approaches that really support safeguarding outcomes. So data analysis in West Mercia data linkage project revealed that people on probation have higher rates of attendance at A&E, for example, present with high levels of chronic health conditions and are often resident in areas of deprivation. So we heard how the Health and Justice Partnership leads had bridged that probation and probation and healthcare systems. They'd introduced peer-led health education campaigns, and that had really helped reduce stigma and promote engagement with healthcare services. So this approach really demonstrated how safeguarding can be strengthened by embedding access to healthcare, continuity of care, and also that lived experience into probation practice. Next slide, please, Holly. So this slide showcases two examples of effective safeguarding practice, which illustrates how probation services and partners could strengthen safeguarding for adults under supervision through targeted collaborative approaches. So in Kent, Surrey and Sussex, they targeted commissioning to address unmet needs and reduce safeguarding risks. So they'd used ROI funding for innovative projects to really fill the gaps they'd identified in their local provisions. So you can see from the slide, there's some examples shared, and I'll go through a couple of them. We heard about telephone substance misuse counselling, so that was provided by Surrey Drug and Alcohol Care, and that was an accessible support for those individuals that were unable to attend probation in person. We heard about mentoring in Maidstone, so again, minority individuals being supported by those with lived experience. Wraparound housing support, which was critical for stability and reducing vulnerability. And also youth mentoring for under 30s with gang-related histories. So that was a real prevention and rehabilitative intervention that was focusing on that particular area. And trauma-informed culturally responsive delivery, so really ensuring that services were meeting diverse needs. So this data-led commissioning and collaboration with PDUs really enhanced the safeguarding and rehabilitation in KSS. And in Basingstoke, we heard how leadership and structured processes were strengthening safeguarding in multi-agency settings. So MAPA chairs had received targeted guidance and tools which expanded focus on vulnerabilities such as things like gangs and exploitation. And also safeguarding was also prioritised for remand prisoners within local business plans. There'd been Q&A guidance for MAPA chairs issued, which was creating and supporting that real consistency in decision making. And we'd also heard about shared learning from serious case reviews and bespoke resources that were being made available via PowerPoint and SharePoint. And also equality, diversity, inclusion was embedded as a standing item agenda on their MAPA meetings. So the region had seen a number of benefits as a result, and this included continuity of care through that improved data use and health services engagement. And they'd also seen 94% attendance from duty to cooperate agencies. So that was providing that really strong multi-agency commitment. And there'd also been a real positive shift in terms of that shared understanding about vulnerability and how that was integral to public protection. So these examples demonstrated how proactive commissioning and leadership development could significantly reduce safeguarding risks and improve outcomes for vulnerable adults. And both approaches aligned with HMIP's emphasis on collaboration, data-driven decisions and inclusive practice. Next slide, please, Holly. And then finally, just to highlight some effective practice examples with regards to engagement strategies. So safeguarding is not a standalone process, but it's embedded into everyday interactions, assessments and service design. And engaging people on probation through safeguarding initiatives is really central to effective practice. And as has been mentioned already in the presentation, research really highlights that the quality of supervision is really closely linked to positive outcomes, particularly when practitioners adopt a relational approach, a trauma-informed approach that really recognises individuals' health and wellbeing needs. So on our website, we've got some research bulletins, academic insights that really speak to that work and the importance of it. So if you're interested in some additional reading, I would encourage you to access the website. But on the inspection, we did see a number of examples where services were trying to implement practical strategies to really engage people on probation and promote that safety, inclusion and long-term change. So in Liverpool North PDU, they'd strengthened health pathways through a proactive evidence-based approach that had been informed by a survey of 150 individuals. So for women, collaboration with Merseycare enabled fast-track GP registrations. There was direct access to talk and therapies, and there was also plans for an on-site trauma worker. And for men, gaps were being addressed by introducing physical health checks and deploying mobile NHS units. So that was including the Live and Well bus and the Liver bus that you can see on the slide. So these buses were attending probation sites and prisons to really encourage the people on probation or the people in prison to access that service. So these initiatives were embedded within the wider combat and drug partnership strategy, and it was improving integration with mental health services. It was promoting trauma-informed equitable practice for both men and women, which was really important. So this work really demonstrated how tailored interventions, health interventions and strong multi-agency partnerships could enhance that safeguarding and support rehabilitation. And then in Coventry, the Engaging People on Probation initiative that had really transformed safeguarding by promoting that relational and person-centred approach. So sentence planning was co-produced and focusing on what individuals needed to feel safe and supported. Peer mentors with lived experience played a real key role within the region and were really breaking down barriers and influencing practice regionally. So that wasn't just with people on probation, but also with practitioners and leaders within the region as well, and having that influence. Inclusive engagement through focus groups and cultural awareness resources had shaped improvements, and it was supported by a You Said We Did approach in their actions. And there was things like welcoming reception spaces that were making a massive difference. And within the effective practice guide, there is a recorded, like a voice recorded clip with a person on probation who talks about what safeguarding means to him and what probation could do better, but also what probation was doing really well. And that was part of a package that was played within the reception area. So when people on probation were waiting for their appointments, they could hear from peers in terms of their experiences, both positive and also, where things could improve. So that was a real kind of motivational tool and something that was really engaging people. So surveys within the region showed that there was real positive impacts from their approach. There was 76% of people on probation reporting that they felt that their life had improved while they'd been on probation. So this approach really embedded safeguarding in everyday practice, recognising vulnerability as integral to public protection and strengthening that trust, safety and rehabilitation. So as I mentioned, there is a lot more examples in the effective practice guide, so I would encourage you to go and have a look at that. But thank you for listening, and for now I'll pass you back to Martin. Thank you.
Excellent. Well, thank you very much indeed, Helen, and thanks to everybody for listening to the presentation and for all of that input that we had from everybody there. So hopefully that sort of gives you an overview of what we found on this thematic inspection. Now the Q&A box has been heavily used in relation to questions sort of starting to emerge. Now I suspect it's probably either Louise or Holly are going to maybe act as the compares for the Q&A and maybe sort of pick out some of those questions. But if people want to also raise their hands, we can also bring some questions in from the people that are listening. But Louise, is it going to be you?
Yes, no problem. Should we start with a few from the Q&A and then see if any hands go up? We can always move on to those.
Perfect.
So I'll start from the beginning as we go through. So this one's from Eliana, and she's asked, in cases of a death under supervision, what is the process for involving external agencies that deliver commissioned services on behalf of probation? Is the review purely an internal process, or are learning points and improvement actions shared with the external commissioned services involved?
I think Mr. Miners knows I'm going to come straight to him on this question.
Yeah, it's an internal process. There's no provision necessarily for going external. There'll obviously be analysis of whether external services were delivered on that case, but there isn't. And I think it's a really valid question. It's not a process which is inclusive necessarily of talking to professionals from other services, or necessarily questioning maybe their decisions. I'm sure information might be exchanged from the analysis of that, but it isn't something that is part of the process. What we have emphasised, and I probably should have said it in the presentation, is we think there's a gap in terms of the safeguarding adults boards, and I do understand that. I've attended enough of them myself. They're big talking shops, and often their priorities, quite frankly, aren't people on probation, and it's often specific groups in the community. And to be fair, there's massive pressure on adult social care, but we do think those boards are an opportunity to share information about the probation caseload, the risks they face, but also the findings of the death under supervision process. I think the question is valid because also it's sort of, I'm not saying, I think got to be absolutely clear, it's not the same as the SFO process, but the SFO process, I mean, as an inspectorate, one of the things we recommended was to include other organisations in terms of their role. When we did that report 5 or 6 years ago, and I think is absolutely key given our findings and the difficulty of engaging in certain services, even where the probation practitioner might think they're necessary. I think it is valid that there should be due consideration to that. And I just think finally, everyone talks about how important the probation service is, and little role. I think what it shows, this report, is that probation needs more leverage in terms of making services engage with what is, let's be honest, we're saying it's got risks and vulnerabilities, but it's also a very high risk community for society. Even at MAPA, services have a duty to engage. They do not have a duty to deliver services, and that's an ongoing tension. Anyone who's managed even MAPA 3 meetings will know that there's always a tension. There's frequently a tension around that.
Thank you, David. A really comprehensive answer to the question. Louise, take us where next? We've got a hand up from David. We've got some more questions in the chat.
Thank you. We'll do one more for the chat and then come to you, David, if that's okay. We've got one in the chat from Rhiannon, who works with trainee probation officers, asking whether this thematic looked at the training delivered to probation staff on self-harm and suicide, and if so, whether that is sufficient in equipping staff in understanding risk factors, having trauma-informed and sensitive conversations with people in crisis, and knowing what to do with that information.
Yeah, we did. Shall I answer that, Martin? Yeah.
Absolutely, David.
Yeah, we did look at the training, and I've forgotten what it's called now, but there has been some training introduced in the last 18 months, 2 years. Like I said, it isn't mandatory at the moment. I think it's required or, desirable. In terms of the feedback we got on it was that people were quite positive about it. And we had a member of the team did look at it, and their view was that it was reasonable. I think the problem, and it's difficult because online is the reality of the world now. We're doing this online, but it's an ongoing process. Some of these areas, you can't just do 2 hours suicide training and then feel you're trained in suicide. And actually, informal discussions, informal knowledge is really important. So you need the informal knowledge within a team as well as the formal training. And I think developing that is still a work in process. But yeah, no, I take the point. I think probation operates within a grey area, whether that's within public protection or whether it's within safeguarding the people on probation themselves. And I think you can't necessarily reduce it just to black and white, and sometimes some of those training scenarios do that, and it's really important that people have the confidence and the professional knowledge, I guess, to understand that for one case you make one decision, but for another case with similar circumstances you might have to make a completely different one.
Thanks, David. Just on the training question, one of my observations from having spent some time out in PDUs, when the sort of blend of a lot of the training is now available online, I think in the PDUs that do it better, what they use is almost use that to provoke then some local discussions and collaboration at a PDU level in relation to, okay, what does that mean for our practice? And certainly that's something where we tend to see people having a conversation about the sort of training that they've done. But of course, what we also understand is the fact that there's a huge amount of pressure on staff in relation to the cases that they're managing and this sort of thing. So quite often people are squeezed in relation to their ability to do stuff that is highly desirable. Certainly, I think there's more that can be done, because there are significant benefits, I think, for probation practitioners to ensure that they understand that it probably helps them in the long term to doing the job. Louise.
Thank you. Could we ask David Messam to come on to camera now and ask his question?
Yeah, thank you, and well done, Louise. You got my surname right, so I remember you for life. Yeah, David Messam. I'm the head of Essex North. First of all, really good overview of the the thematic and really good presentations from all involved. I just want to go back, if I may, just to the death under supervision. And I was just wondering your views, or whether you've got a view in terms of that systemic piece, whether a route might be via serious adult reviews, because that I think that talks about, and I know that's quite specific in some ways, but it talks about agencies working together. And I think you're right that your observations around other agencies stepping back when probation are involved is spot on, and it creates so many problems, particularly around mental health services and so on. So I really do welcome that in the piece. So, but it was that piece, and I'm just wondering where that might be a door where we can actually push against to get that those issues highlighted.
David, do you want to have a crack at that? And then I might add a couple of observations at the end if I can, because I think it's a really helpful and interesting point, David.
No, I think that's a really fair point, David. I do. The serious case reviews, obviously they have to be initiated by the safeguarding adult boards, but I understand what you're saying in terms of having a more multi-agency approach, and particularly maybe in some cases, some cases death under supervision, it might purely be a health issue, but where there's a drug-related death, or whether there's a suicide where other services are being involved, that might be something. Whether you can do that under a statutory framework. I mean, the issue with death under supervision, of course, is as it stands, is probation it's only probation. Therefore,
that's right.
People have to comply. Whether you can make other agencies comply or not, I don't know. But I think certainly that might be it's quite a good idea in terms of if you were working with your safeguarding adult board, that might be something you could do initially, even on a voluntary adult basis. So I think that's a really, really good idea. I certainly think safeguarding adult boards should be aware of the findings in terms of death under supervision figures of the caseload you're working within your PDU or within the PDUs, because what we found, I did speak to the SAB chairs in each area, and they had limited information in some cases. Some cases they had the lot, but in some that they didn't. And there was also a bit of caution about whether we should share this information. And I think we absolutely should share that information.
Excellent. I totally agree with that, David. Just one observation from me, David, and until you asked me that question, I hadn't quite thought of it, but there is a ministerial board on what is described as deaths in custody that primarily looks at obviously deaths in prisons, deaths in mental health institutions. They've now started to look at deaths in approved premises as well, and certainly recently I provided some feedback in relation to the initial outcomes of our approved premises inspections. I think there might be an opportunity to open it up in relation to deaths under probation supervision. It's a very different thing, of course, because those people are not in custody, but of course they are within the care and supervision of the probation service. I'm more than happy to raise this as a question. I suspect some senior level attention in relation to how do we get other agencies to be involved so that, you know, our probation practitioners can get all the help they need in dealing with these issues would be a good thing. So really happy to pick that up the next time they meet, which I suspect will be January, February time, something like that. So I think it's a really good suggestion. Thank you.
Okay.
Louise, where next?
That's it for questions for now. I would just like to highlight there's a comment in the Q&As from Deborah Street saying that there's some really interesting points from a speech, language and communication perspectives, particularly in the peer-led solution suggested. I don't know if Deborah's still online, if there's anything that she'd like to add to that, or David, if you had any thoughts.
No, I'd have to look at that. I'd have to have a bit more detail about that before I've got any thoughts on it. I'm not sure I can, on the spot, give an
Hiya,
informed
everybody.
view.
I am still here. So I'm speech and language therapist by background, and it was just a kind of point of the identification of speech, language, and communication needs within or for people that are involved within justice, and kind of that interworking between health and justice from speech and language perspective, really. But it, as I say, it was quite interesting to see that was something that was naturally kind of identified and brought out in the peer-led suggestions. It was interesting, so thank you.
Yeah, thanks for that, Deborah. I think it's really helpful. I mean, the other observation that I would make, and I'd sort of compare this, obviously, as the inspectorate, we look at two distinct areas. We look at youth justice, we also look at adult probation. Speech and language tends to be a really significant area of focus within youth justice. But of course, when you then go look upstairs into the sort of world of adult probation, a lot of those issues continue as part of it. And I do think sometimes we need to sort of widen the lens in relation to giving people assistance, because of course it does create barriers for people in relation to accessing the services help that they need as part of that. David, you got your hand up, so maybe you can help me with this question, or maybe it's another question.
No, it's another question, sorry.
That's all right. But no, I think it's a really, really good point. It's certainly something that comes up regularly in our youth justice inspections, and going forward, it's something that we certainly want to pick up. Thank you.
Yeah, I think, yeah, absolutely. I think that's the thing, isn't it? There's a lot more evidence for youth justice, and kind of there's not so much moving into adult services. So yeah, absolutely. Thank you.
Perfect. David, can bring you in with your other question now.
Yeah, I should have gone off camera here because this is quite I don't know if it's a controversial question, and okay, I'll ask it anyway, and I'll deny it after. I suppose you do a lot of work around thematics around children, and I just wondered your views in terms of whether, I know there's work to do in terms of children, you've highlighted that in reports, but I was just wondering whether you think that we focus a lot more on children than we do adults. It's not an either or, but I suppose I'm asking the question because it just so happens an email dropped yesterday where safeguarding adult boards are basically saying, you know, they've costed how much through contributions probation contribute to safeguarding adults, which is pence, and how much it contribute to children, and given that obviously we supervise adults who have contact with children, but a lot of the individuals we supervise, well, all of them are adults. So, and it's kind of a sensitive bit, isn't it? So I just wondered from your own experience whether you think that the balance is right, recognizing that it's not an either or. I know that sounds that's a bit contradiction.
David, I think that's a brilliant question, not controversial at all. So certainly don't apologise for asking it. I think it's great. I'll go to David first of any observations, and then more than happy to sort of feed in myself.
I think definitely in terms of probation practice, there's been, in terms of culture, there's been a greater focus on child protection and safeguarding children's boards than safeguarding adults boards. And you just confirm that in terms of the contribution. Has there been too much of a focus? I wouldn't want to undermine the focus that's been on children, because, you know, we know the damage. I've just read out the damage in terms of what happens to children. The children we were supervised as adults were the children who were the victims of all that domestic abuse and all that domestic violence and neglected behaviour when they were children. So I wouldn't want to undermine that. Do I think the focus on adults? I think that in some respects this is a political question. You know, probation wanted to be tough 20 years ago. It wanted to talk about public protection, and that's what the public want. Make no mistake. They don't want to hear that these people have problems and that these people have traumas and that they're very, very damaged individuals. But actually, if you're going to protect the public effectively, you've got to acknowledge that and you've got to work with that. But it's how you manage that political climate and then how you manage that professional climate. So I would say, in terms of what you're saying, I would say wouldn't want to reduce any focus on children, but should there be a focus on the experience, a greater focus on the experience and the reality and the meaning of the people's lives which we supervise, rather than simply demonize them in terms of the behavior they commit, to manage them effectively for the community, then certainly. And I think part of that is engaging services, and I think part of that is engaging at safeguarding adult boards to make that argument and just to make them aware. Because like you said, I think earlier on, absolutely no doubt, there is the if probation are involved, other services feel they don't have to take responsibility. They know the probation services focus has changed, but it actually suits other organisations and sometimes other professionals to keep probation in that welfare box. Oh, if probation are involved, they're dealing with the welfare, they're dealing with the accommodation, they'll deal with any mental health issues, psychological issues as well. Therefore, we don't need to be involved. And anyone who's been in the system as long as I have has heard professionals say, oh, that's a criminal justice issue, that's not a mental health issue, and that's basically a professional culture excuse not to engage. And does that need that engagement need to change? Do probation need to be making that argument stronger? Do they need the support from the centre to do that and make it stronger? Absolutely, and that's why Chris Whitty's recent report is so helpful, and the strategic initiatives at the centre in terms of health and justice workers, I think, are really valuable, because effective engagement around health and justice is also effective engagement around public protection as well.
Thanks, David. I should observe, it's the pleasure of having two expert Davids on this call is fantastic. I think you're absolutely spot on. I think there probably needs, I mean, we did our young adults thematic last year, and one of the things that we picked up upon is the way in which the system and wider agencies view children changes, or is certainly perceived as changing the second somebody crosses that threshold into 18, and they start to become a problem for the adult criminal justice system in that way. I think, and my earnest view, having been around this system for far too long, is, of course, public protection is important, but actually a level of understanding of what are the right things to do to ensure people are given the opportunity to turn their lives around and understand why they're in the position that they are. And certainly, I think a lot of people on this call, and hearing the user voice stories earlier, you know, if we focus on how do you give people that assistance, I think we'd have. And my challenge back to the politicians and actually the wider system on this, because if we do that, we'd have safer communities and we'd have fewer victims. If we were able to give people the help that they need, the homes, you know, the roofs over their heads, the help with drug problems, mental health and other things. And I think that's the real strong line I got from David's excellent work on this thematic, is, of course, you can understand the barriers, but actually if the system worked together better, we would get better outcomes, both for the people on probation and communities. So therefore, I think the tension, or the perceived tension, is a false one, because actually if you take the right decisions here, there are better outcomes for the long term. That's my view, but I'm just the chief inspector, so that I can say these things, can't I, in that way, and we'll see where that leads us. But that certainly would be my advice to ministers or to parliamentarians who were thinking about these issues, is, you know, a greater level of understanding would be a good thing for us in the system to have. Thank you very much indeed for that excellent question. Have we got any more questions, Louise? We are into the last 3 to 5 minutes, I think.
No, that's it for questions. So unless there's any last hands to go up, I think we're all clear.
Thank you very much indeed. So I just want to thank everybody for listening so carefully to the launch of this thematic. Thank you to the team that have given such excellent presentations, but also thank you for the really excellent questions. So do keep an eye out. I mean, we regularly run these thematic launch events. We've got a strong program. We're currently consulting on our thematic program for next year as well. So if you're interested in what our priorities should be for the future, feel free to sort of input on that. It's a pleasure to see you all, and I look forward to seeing you hopefully at one of these future events. Thank you very much indeed. Thank you.
Thank you.